Hello there. I'm going to quickly check on the audio just in case if everything is fine. Let me just check the audio. Okay. I don't know why, but my notifications are not working that quickly. I don't know why, but my notifications are not working that quickly. Okay, it's done. So, okay. So first of all, I'm terribly sorry if I haven't come online for the last couple of days. It's been quite difficult around here. It's been quite crazy, I think. But everything has to do with the fact that everything's just crazy right now about the pandemic disease and the coronavirus and everything. So everything's been stopping, like everything's been canceled, everything has been moved. If you had things that you were going to do that was like in public spaces, or if things are just you know getting out of hand, they're just trying to control it by stopping you, or the, like putting you in quarantine. There are certain things that I am okay with, that has to do with the fact that you don't have to be close to so many people right now. It's better to keep safe, like being at home, it's fine. Just go outside if you really need to go outside. Anything else can wait. Anything else can wait. So what's going on here, which is a third world country, it's it's difficult to explain because it's not easy. It's not easy for people to be diagnosed or to know what's going on. So first of all, we're not still placed in quarantine. We are still being able to go out from our houses, and to go to work, and to go and buy things, and to you know doing what you need to do normally as any other normal day, right? But but we have already closed our borders, and traveling from outside and from the inside, no one can come in, no one can go out. From foreigners starts from today, and for the local people starts from tomorrow. So all of the people that are coming around today and tomorrow will have to be placed in quarantine. So that's something that obviously depends on the person or the people that are coming from the infected countries. And that's what's been going on. People have been coming in from other countries that are being infected, and they are having all of the symptoms here. So they're coming from Spain, they're coming from Italy, they're coming from New York, they're coming from, I don't know, from different countries, are coming around the world. And that's what's happening. I mean, that's why people are getting sick here, because they are escaping from the countries that has already the disease, and they're coming here thinking that they're going to escape from the virus. But they're not. They're not actually escaping from the virus. They have the virus already. I think that's reckless. I think that's reckless, and no one should be traveling around this time. But anyways, if you have like a really like urge to travel, then go ahead. But what's going on here is that, first of all, I think we have more cases that the government have been stating that we have. At the moment, the last news that we had was that we had 37 cases of the coronavirus. And 2 deaths. So, as an exact amount, there are 35 cases. From those 35, more than half of the people are being contained here in the coast side, so in this city where I'm from. The other ones are from the highlands, and there are 2 that are being in a reserve state, so they are not mentioning how they are, and there are 2 that already passed away. They have different ways of containing this virus. So one of the ways that they have mentioned is that they are closing all the borders, as I said. They're not letting anyone to pass. They're not letting anyone to go. They are also closing the state parks. They're closing the state swimming pools. They're also asking the private swimming pools, gyms, theaters, cinemas to close. They're also mentioning that people shouldn't be going to big gatherings, no more than 30 people. So they're closing like weddings and birthday parties that are for more than 30 people. So, and that's the problem. And that's going to happen. And it's so sad to see just what happened in Italy, and it's been repeating in every single country, because people, they don't care about this. They think that if it doesn't happen, I mean, if it's not happening directly to their families, it's not happening. And that's not true. It's happening. It's true. People are getting sick, and people are dying. People are dying from this. But they don't care. They actually don't care. So what I'm saying is that please be safe. Please stay at home. Please try not to go to big gatherings. When I heard that there was going to be a pandemic, I mean, that the coronavirus was already being like moved to a pandemic disease state, I decided to go as quickly as I could to get food, to get not medicine, but like to get the different kinds of foods that I need here, like legumes and fruits and vegetables and meat and the normal basic stuff. I think I'm still missing a couple of things that I'm going to be buying in the next couple of days. But the thing is not being as crazy as people are being looking in all of the videos and pictures that have been around the internet the last couple of days. So just thinking about seeing people buying toilet paper as if there is no tomorrow, I don't think that's right. And the other thing is that if you think about it, there are things that aren't that necessary. Like if you want to buy like a package of toilet paper, it's fine. But I've seen people like buying 2 or 3 or 4 packages of those. Why? I actually don't know. Do you have that urge to be in the toilet when the virus comes? Like, we are getting out of stock of all of these things that are important, but they are not as important to be covering for the virus. I don't know if you get my point, but it's not necessary. It's not necessary. We don't need that. And we don't need too much. I mean, we need like maybe 2 or 3 kilos of rice, maybe 2 or 3 kilos of meat. I mean, just to have it, just to save it for like 1 or 2 weeks. So that will be fine. I mean, that's something that we don't need to like overdo it. We don't want to stay 3 or 4 months at home. We want to just like be, I mean, be able to have enough. Be able to have enough for our family, but not taking food from other people because we are scared that we won't be able to buy food again. That's not true. Things are not stopping. Production is not stopping, right? We still have our supermarkets open. We still have the pharmacies open. Maybe you want to get a couple of things that you're missing for the time being, but you don't want to buy things for at least a year. I mean, that's the scary part. Seeing how people are not interested in wanting to coexist with other people. It's like I am worrying about myself. I'm just going to like get everything for me and for my family, and then you you can get screwed. Even if I'm going to start like losing food and money. Because if I am buying for like 2 or 3 months that are foods, for instance, fruits and vegetables, right? You need to have a really good freezer to be able to save all of that. Else, everything's going to go to waste. Why? Because of you being scared that you're going to lose anything or everything. I'm sorry. I don't know. I I have seen how people are just going and buying things like crazy, and that is not good. That's even worse for our economy because we're just like getting everything like in one side, and people that really needs the food, they're not receiving it. For instance, the elders, the ones that they don't have anyone to take care of, they are going on by themselves to get the food. They are not as fast as we are. They don't have the enough money because they're not working, so they depend from the government, so they are waiting for the money to get the food. And until then, everything has been taken out. Like everything is ran out of stock. Like we are taking all of the toilet paper packages. What they are going to buy? They're not going to buy anything, and they need it. At least one package. That's my desperation, and that's why I decided to come online just for a while. I I mean, I was planning on coming live yesterday, but I'm sorry, I was really tired. I thought that I was going to be able to, but I didn't. Um, I don't know. It was quite difficult for me, and I'm still like I'm still working in different things. Like I'm working in a video that I wanted to post from the one that I posted in Spanish. So be looking forward for that. And as what's been happening with the coronavirus, I thought that I was going to have my new tool, my new things to be able to edit a little bit faster. I won't be able to. So what's done is done, right? So I will still have a little bit of a problem just to try to deliver more videos for you guys. I have, as I said, certain videos that I have in mind that I have to start recording. I am hoping that I can do that this week. Let's see how everything goes. I know that this wasn't even planned, so I am not hoping to have people here. But if you are watching this live, please be safe. I'm really thankful for you being a guest watching this live later on. I do think that we need to take care of ourselves. I will love to have everyone here back again after everything passed, and just to have like, just to say that it was like a crazy nightmare, that it wasn't even real. And the only way to do this is just to help ourselves and not letting this to happen again. I mean, I'm hoping that China got everything like in place with exotic animals and all of the laws that were going to pass for that kind of thing. But if they haven't, then we have to be prepared the next time, hopefully, if we are still here. I mean, I don't want to be that negative because they shouldn't be that negative. But what I'm worried about, is the elder. At least in this case, is my parents, or my parents, and my grandpa, which he's really old. That there are people that even if you say, but it's just like a big circus, and everyone is just trying to get a hold of whatever they can to, I don't know, get money and scare people. Yes, it is. And even though you are saying, okay, I'm strong enough to go through this, what will happen to them? What will happen to my parents, for instance? What will happen to your parents? What will happen to your grandparents? So if you still have them, cherish them and take care of them. Don't be reckless going out. Don't be reckless going to party, going to places that are there are a lot of people there. Just try to be safe. It's better to do that. It's better to take care of yourself instead of just thinking that it's more vacation on your side because you're not working or you're not studying, you're not going to school or to high school, or I don't know. The thing is, this is not a game. Everyone needs to be prepared, and that's how it should be. So that's what I wanted to say. I I wasn't even thinking about coming live. Maybe I can come online later on to see if I can catch you live. I can catch I can catch you guys live. I just came a little bit just to say hello and saying, hey, I'm fine. Um, I am. Hopefully, I'm not sick. Well, I do have like some sort of like sore throat, but it's nothing to worry about. I don't have a fever, not that I think of. Um, my body is aching, but I think it's just my normal problems. And yeah, that's it. I'm hoping that everyone is fine, that everyone that watches this live are fine. Guys, if you want to tell me how are you feeling, if you have got any symptoms, if you want to talk to someone, please do it in the comments below. I will be answering any comments. You know that I'm like that. So if you want to start a debate about it as well, I know that certain people, they don't believe about the coronavirus. They think that it's just like everything has been like, I don't know, created by the government, which in this case it could be, but the thing is like it's getting real. It's getting closer to home, so it's getting real. So I just want to be prepared. And I want everyone to be prepared. I don't want anyone to be suffering for anything that we didn't take care of before. Right now we still have time. Right now I think we still got the time to think about it, to go and get provisions, be safe, staying at home, don't go out as much, trying to hold on where you at. I think that it's much better to just hope that everything goes well or to get better, but we need to take care of ourselves. I think it's much better to do that than to just let this pass. That happened with the AH1N1, which was declared as a pandemic disease, and so many people died. Maybe you didn't take care of it as much as you think you need to take care of now, but that's the best way to do it. I think that's the best way. Hey, hi Sephora. Haven't seen you for a while. Thanks for coming live here with me. I I do believe that we need to take care of each other. Like we need to take care of ourselves. I was just like talking about how things has been going here in my country, which is a third world country. So they have already closed the borders. They are not letting anyone pass, and they're not letting anyone in. They are closing every single event. I know, I'm guessing so because I haven't seen you in any lives like the ones that I have been doing the last couple of days, but it's fine. You know that you can pop in anytime. So I'm hoping that everything is fine on your side. On our side here, they are, as I said, they are closing everything. They are like closing and canceling any event, any place that you can go that are for more than 30 people. They're closing it. I think they're still leaving the malls open, but I think they're like letting it for the people just to go if they need to. I'm hoping that they're not getting us into this quarantine just like Italy. At the moment, we have 37 cases of the coronavirus being detected and 2 deaths. Let's say that my country is, I think, is a little bit smaller than New York. I think, or it's just like the same size. I will have to see, but we are really small country. We are not that big. So it's getting it's getting it's getting more and more and more difficult. Oh, that's great, Sephora. I was just thinking that people weren't getting my notifications. For instance, I have my personal account when I'm checking if I get my notifications, and I'm not getting any notifications at all. So I don't know. I was just thinking that maybe YouTube wasn't going to like letting my notification passing through, and that's why. But yeah, it's been quite crazy. Like things are getting a little bit crazy at a time. I don't know how it's been on your side. What's been what the government has been doing on your side to contain the virus. I know about Trump saying that he was going to put the whole country in an emergency state. I know about Italy that it's been completely closed. That's great. That's great. That's great. It's great because the only way to try to keep healthy and it's to eat and sleep properly and try to just avoid going out. And if you need to go out, then you try to go for things that you really need to go, right? It's not that you want to go out and just like to enjoy, I don't know, going to a mall or going to a public park. That's why everything is being closed here, which I do understand. Um, but I think they are doing it not on purpose, but I think they are trying to contain the virus. But it's too, um, I don't know. I think they must have done it before, not now, at least in my country. So in my case, we're doing the same thing. We're trying to eat healthy. We are trying to, I don't know, keep on going, see how everything has been unfolding. At the moment, everything is just quiet. They're just giving more cases of the coronavirus, telling people that just stay in home and be safe, etc. And that's what's been going on. And because I have been online like in 3 or 4 days, I just want to make sure that people knows that um I'm not sick, by the way. I have a sore throat, but it's nothing. I think it's nothing. So no one has to worry about that. But I hope everyone is fine, by the way. I hope everything is fine in your side, that your family is fine as well, because we do have our families and we do take care of them, but we cannot stop them to do their own thing, right? If they want to go out, if they want to like do other things. I mean, I have seen family and friends going out, going to the beach, going to enjoy, even though the government have said, please stay at home. So I know they are reckless. I know you cannot stop them. The only thing that you can do is trying to pray or try to tell them not to do it. Hi, Chicano. How are you? We're talking about a little bit about the coronavirus, by the way, and how is everything been unfolding here in my third world country, by the way. California, we're shutting everything down here to keeping our distance from people. They need to okay screen people going in and out of whatever country. Yes, it's true. It's true. Everything is just, I mean, everything has been crazy. People are just trying um, to control it, but there's some other people that are just avoiding it. They're just trying to, um, I don't know, avoid the warnings that the government is given, and they're just doing whatever thing they need to do. Like if they need to go out, they will go out. If they need to like go to party, they will go to party. If they need to travel, they will travel. Being reckless, right? I'm not saying that you shouldn't be going out. You shouldn't be, um, you know, doing what you need to do. Okay, it's fine. You need to work. You need to buy groceries. You need to get certain other stuff. Hey, Nicholas, how are you? How are you? We were talking about the coronavirus and how things are being unfolding here. You want to get a little bit on the chat? That's great. The same thing here, Chicano. The same thing. The same thing here. Um, things are just everything has been closed. Everything has been banned. Um, let me put them. Wait a little bit. Okay. Hello.
Hey, how's it going?
Hey, it's fine. It's fine. Thank you. Thank you for coming in. We're just talking a little bit about what's going on about the coronavirus and stuff. It's been crazy the last couple of days for us, at least here in this country. So I was just asking Chicano and Sephora um, what's going on in their sites, but I think both of them, because one is in California and Chicano is from Texas, so I'm guessing that they already have like um, their own states. I mean, they're already following what Trump has been saying, at least.
Sure. Yeah,
Uh-huh.
I'm from one of the prairie provinces in Canada, and I think it's been very similar here in that local organizations are starting to shut things down and stuff. It's not like we're getting quarantined or anything. We have very few cases where I am, but we're preparing. I think I heard a stat that 30 to 70% of Canadians will be resolved or will be affected by this. Uh,
I heard that the wife of the prime minister was
that's right.
right, was
Yeah,
it had she was positive for coronavirus test,
yeah,
right?
yeah, yeah. That's right. Which she's young, she's fine. But something else that I've been noticing that's really got me worried is this illness takes so long to resolve without any sort of solution to it, right?
Yeah.
That if we look at some of these countries where we've just seen a huge increase in the cases, like Italy and France, the number of cases of people that have died is sometimes higher than the number of cases that have resolved. And
Yes,
that's
exactly.
scary. That'll change, but right now that looks really terrifying.
Exactly, but I think it's because they have been reckless and people they are just realizing that they did wrong. I mean, they had their so-called vacation. They just decided to go to family gatherings and to parties around and etc. So that's how everything has been like escalating so quickly. So Chicano is saying in my country, which I'm guessing it's Mexico, there are 8 confirmed cases of coronavirus. I don't know, Chicano. I'm sorry if it's not Mexico, just let me know. But there are 8 confirmed cases of coronavirus, but they are like 2 million people living in the country. So for saying this is really bad. I hope you guys are secure. Yes, it was she was positive. I think she's talking about what I'm telling it before, and Iran is bought too. So you are secure there, right, Nicholas?
Yeah, like I think that I probably will get it if I haven't gotten it already. But
Mm-hmm.
that's not a serious problem for somebody young and healthy like me. I'm more concerned about things like my elderly aunt. So doing what I can to try to protect her, but at the same time, she doesn't want to give up her life, you know.
Yes,
And
exactly.
I think that there's a part of her that says, I've lived a long time, and I'm going to just trust in God and continue living my life, and we'll see what happens. Which is a little bit reckless, but it's her life to live.
Yeah, but that's yeah, they're already adults, so they can decide.
Yep, yep.
So Chicano, oh, I'm sorry, it's the county. I'm sorry, the county is a subdivision in the state of Texas. Okay, okay, good. Oh, okay, it's just like my city. We have municipio as well. But in here, we have 19 confirmed cases with one that already passed away, which was, let's say, the patient zero that came from Spain and that just went traveling around the whole country before she was diagnosed for coronavirus. So, in my case, for instance, I have a really old relative, which is my grandfather, and he's already 95 years old. We have already him, I mean, he is already confined in his apartment and he doesn't move too much. So we just we need to make sure not to have the coronavirus because some of us are taking care of him. So
Right.
I think that's the only thing that we have to take care of. The other thing that maybe it's true that if we get the coronavirus, the only thing that I will be worrying about is about what's going to happen next. Because no one is saying what is going to happen because this is not a normal flu, right?
Well, the discussion that I've heard is that it's basically going to be like SARS, and that SARS was not properly contained,
Mm-hmm.
and people died, and then it got into the population. And so, like, SARS is still around and stuff, but it's just not spreading the way it is because it's no longer novel. There's a lot of people that have resistance to it now. Um,
Yes, but not exactly that. It's about you getting the virus and after that, how your body will be reacting from it.
oh,
Because they're saying that you're losing like more than 20 or 30% of the ability to breathe. So I don't know if that's true. They said that they have
Do,
this sort of investigation, but I'm
do
not
you mean
sure.
do you mean afterwards, like after you
Yes.
recover? Yeah,
After.
yeah.
Mm-hmm.
I was looking into that in terms of the permanent lung damage that they're talking about, and they are concerned because SARS is a situation where they developed that fibrosis as well,
Mm-hmm.
and so that is a really interesting concern.
Exactly.
I think it's going to be similar to SARS and stuff, though. I think in hindsight, we're going to feel like we made some mistakes, but we also, as the public, overreacted a little bit in terms of concern. Like, be smart, but don't be worried all the time. I don't think the world's ending or anything. This is going to hurt us economically,
Yes.
but
I mean, we have our economy already like going down. I think in every single place it's just the same.
right, yeah. I think that there's going to be a great upturn, especially in the United States, when we see the inflection point there. Uh,
Mm-hmm.
uh, I think that there will be a lot of confidence. And I think if you're not in a situation where you're desperate and you need to take out any investments right now, that this is an opportunity to really plan for the future and invest. I mean, if you want to go flying, you can get tickets for in 7 or 8 months from now. And
Yes, exactly.
this coronavirus will be all taken care of by then. And the tickets that you could buy right now are super cheap. So, this is a horrible situation, but I think the Japanese word for chaos is opportunity. What is it? Opportunity and chaos and opportunity make up.
Mm-hmm.
What is that adage?
Uh, I don't know much of them. I know it in Spanish, so but I get your point. It's like you need to take you need to make sure you're getting the best when there's chaos. So you
Oh,
take uh-huh.
uh, oh, no, yeah, okay, yeah. So it's the Chinese word. Well, maybe it is also a Japanese word, but it's Chinese word for crisis is
Mm-hmm.
composed of the Chinese characters signifying danger and opportunity.
Okay.
And
Okay, it
so,
sounds logical.
yeah, yeah, and so I think that this makes sense. This is a crisis. It's horrible. We should help each other. We should be smart, but also, tomorrow's going to come. Plan for that.
Exactly. Exactly. We're not planning for today, we're planning for tomorrow as well. So Sephora is saying hit the like button. Thank you. And Chicano is saying, I'm wondering about if quarantines are put into effect. How will it work financially if people have no savings to live on and cannot pay bills? Will they be left to be homeless or suffer further? Um, I don't think that work. I mean, it works that way. I mean, I think it depends on the city as well. For instance, in my city, they have already said that they're going to, in certain facilities, they're going to condone, um, let's say, the payments, for instance, for water. Um, if people are not paying, they're not going to cut the service. And I haven't heard for anything about the electricity or the electric company, but I'm guessing that they are going to do that in the next couple of days. So the thing is that we need to worry about food. I mean, what's the first necessity that we have, which is food and shelter. So if you have a house or you live comfortably and you have enough food for the next 15 days, I think everyone will be fine because you don't have to go out and buy anything else. I mean, the necessity is already covered. I think that's my point of view.
Yeah, I'm just worried about sort of really impoverished communities where I think that there will not be the money to take care of them, and I think that it'll spread very quickly. Like a lot of impoverished communities, they're very tightly clumped together.
Yeah.
You might have 7 or 8 people living together or something like that. And I think it's going to take a huge hit. Which I like. This is the ironic thing is that this whole travesty, as much as it's hurt China in terms of international trade. It's going to help them economically. And that, like, did I talk to you about this before?
No, I don't think so.
Okay, well, like, in the 80s, they instituted their one-child policy, right?
Yes, exactly.
Right, or at least started enforcing it. And so what that did was created a huge bottleneck of the population. And whenever you do that, just like with the baby boomers,
Hmm.
you have an aging population that is no longer able to work. And then people that need to support the economy that are below them, and there's not enough people to support the economy. And so I think an unintended consequence of their single child policy is this bottleneck and this economic crisis that's been coming for a long time, made worse by the fact that a lot of families chose to have male children and would even kill female children because of the way that traditionally inheritance works and the ideas of family in China.
Yes.
Yeah, and so I think they realized the travesty of their one-child policy, which is why they recently reversed it or they changed it to 2 children, I think in 2015
Hmm.
or something. But yeah, this is in the long run going to help them. Actually, they were coming to a really crucial point in their economy.
Yes, yes. And I've talked to certain colleagues that come from China. They're saying just the same thing, that this is going to help them economically. And
Yeah.
I don't know if they have already charged Italy for the help that they're giving. They have been lots of images from, I don't know if it's real or not. They're saying that all the Chinese doctors, and I mean they are helping Italy for all of this outbreak. But who knows if China is already charging Italy for this? But it's just humanitarian.
Oh, I'm not
Everything has
sure.
to do for a reason, right? And even if they are not charging anything, they will be trying to do, I don't know, settlement, or trying to like negotiate something, you
They'll
know?
certainly be getting paid for their work, and also I don't know if this is true. I just heard this on a news program. 95% of the pharmaceuticals
Mm-hmm.
or pharmaceutical products or something like that, or antibiotics, maybe it was,
Yeah,
uh, that is used in the States, are actually produced in China. And I'm thinking that that's probably true for a lot of countries. And so this international crisis, they're probably going to sell off a lot of stuff. And
exactly.
this is the best time for them to do that because after they lost the trade war with the States, all the other countries are going to be coming and taking a piece out of them and lowering their negotiation offers. So this
Yes,
had to happen now for them.
exactly. So Sephora is saying our president said it will take a couple of months for a cure vaccine. Well, they have been saying that they had like maybe two or three, no, there are more, like maybe 10 companies already creating a vaccine for this disease. But
Yeah, yesterday I saw there are 20 vaccine candidates already. One was
you
developed
see,
in Canada, and of course, Canadian media was pumping that up as a great accomplishment and breakthrough.
yes,
Yeah.
exactly. That's what they're doing. And I was just, I think it was on Friday when Trump decided to declare the emergency in the United States. And he was saying that they were getting to like, they were getting closer with all of this um, companies that they're going to try and help people to have the tests ready for them and to travel until, I mean, to travel to all of these rural places, but they can take the test for the people that cannot move from that place. But I'm wondering, that's happening in the States. What's going to happen in different places that they don't have enough money to do that? We don't have enough money to have enough tests.
Yeah. Yeah.
And it's not that we need only 10,000 tests. We need 100 tests, maybe at least one per citizen. So, for instance,
Right.
in here we have 2 million, I mean, sorry, 12 million people or 13 million people in my country. I don't think we have like not more than 10% of those tests here.
Well, that's the really scary thing about healthcare is that it is a matter of how much our lives worth. And that's why I think socialized healthcare is really bad. It would be good to have a charity program to provide for people that are too poor to be able to pay for Medicare, but uh, I think it's really important that people pay for their own care because there is no point where you can't benefit from more medical care. You know,
Exactly.
having better nutrition or having somebody to give you advice or somebody doing checkups on you, extra checkups, those are all good for you. There's a reason why Queen Victoria or Queen, what's her name, Queen Elizabeth, right?
Yes.
Yeah, is still doing so hot. Like, Medicare is not something that you get a certain amount and then you're full. It's just a matter of how much are you willing to pay for.
Exactly. And people here in my country, they don't have enough money to pay for a good healthcare system. That's why they're using the state one.
Right, right.
And the only one that it's available, for instance, is south of the city, so they can go there and get themselves treated. But it's just the same hospital where we have all of the people that has cancer, all of the elder people, the really big emergencies. Imagine having people that are being, I mean, trying to get themselves take care because they have the coronavirus. They go there and they will spread the whole virus
Yeah.
in a really, I mean, it's really heartbreaking to see all of these people trying to take care of themselves, and they are just being reckless and going to where they shouldn't be going, right? I mean, if
Yeah.
we already have places to take care of this disease, they know where to go, but they're still going to the places where they don't have to go.
Right. Yeah. Sometimes I get anxious and depressed when I look at world events, especially when things are going poorly. And a really good thing to do is to go back a couple years and watch
Mm-hmm.
videos and news from things that were going on a couple years ago, and you can look back on it and be like, okay, the world didn't end then either.
Yes, exactly. But I think we are like overreacting. But this time, it's been for real, I think.
Oh yeah, this is a really unique event. It's interesting, and I think that it's going to change a lot of things in terms of our social identity and the way that we think. Like Trump was talking about, hey, maybe we
Mhm.
shouldn't be shaking hands anymore, and I just thought, oh, wow, because when you shake hands with somebody, that brings you so much closer to the person. Like there's something
Exactly.
in our hearts that change when we shake someone's hand, especially when it's a genuine, strong handshake. And the idea that we might just take that out of society for good reasons is really interesting.
Exactly. Hey, Scott. Hello. So he's saying a problem with privatized health care is the better doctors migrate to the private side, and the masses are left with average or subpar care, which is true. The only way to get a proper health care is just to pay for it. But that's when the government has to act and try to pay the good doctors and try to get the good doctors to stay in the state healthcare. But because we don't care about it, we don't force that to have that in our state care system, that's going to happen. And I think it doesn't care. It's not that it's because it's a poor country or it's a rich country or it's an educated country. It doesn't matter. It happens everywhere. What do you think, Nicholas? Do you think that? Or
Yeah,
it's
I think that's largely true that they do migrate to the private sector. Like, we see that a lot in Canada. A lot of good doctors go to the States to earn their money, but it's not always true. There are certain people, like I have family that's in the system, and they are excellent. They're like, could be prime minister sort of stuff, and they choose to stay here and do their work here. So
mm-hmm.
uh, it's not always true, but yeah, like I think that there is that situation, and what I would really like to see is maybe the government sponsoring doctors to go through their education, with the agreement that they would spend a certain amount of time in the social system, so that
Yes.
you would have, because there are a lot of people that want to be doctors, and the only thing that's in their way is that they just don't have the support. And I think people that come from a low background often have more compassion for society than people that come from an upper background. People that are very wealthy and grow up, I think a lot of times get compassion skewed. They have these
Mm-hmm.
sort of academic ideas about how to help people, and it's really not helpful.
Yeah, because they haven't leave
Yeah.
that state like of poverty or just coming from down below, let's say.
Yeah.
So I don't know. But yes, that happens here. That happens everywhere,
Yeah.
which is terrible. I mean, it's as I was saying in here, for instance, we have our healthcare, and I cannot deny that we do have good doctors in the state healthcare, but they're not as much as you wanted it to be. Like you have like the head of the coronary hospital, which already got retired, but he was a really good doctor. But underneath it, you have a lot of really bad doctors, really bad doctors, and and for us in Latin America, we have all of this, like, let's say, knowledge of Cubans and Venezuelans to be the best doctors, which is not true, because we have all of this like left wing insanity created in the people here, saying that they are the best because they haven't been involved with the United States. So
No.
that's why they're hiring Cubans and they're hiring Venezuelans to be in our state medical system, which is entirely not true. We do have really good doctors. But anyways,
Yeah, hiring doctors from Cuba sounds kind of crazy.
exactly, especially that they don't have like enough equipment or like technological advances, well,
Yeah,
advanced system,
exactly.
like
Yeah.
to be able to say, yes, I'm going to take care of you with the best, I don't know, medicine or techniques. So, okay, it says true, we all pay for universal care. The key is that the government should never cut healthcare spending. That way we get the best care we can get. Problem is conservatives cut healthcare first, which is true.
I think if you spent $10 million a year on my healthcare, my personal healthcare, I would probably live to be like 150.
You think?
I think so, yeah. If you invested that much money in taking care of my body, I think that would greatly prolong my life. And I just mentioned that to point out that there's really no upper limit that you can spend on healthcare. You have to make the choice of what's reasonable at some point. And I think that's why we should leave that choice up to people generally. You know, we should have charity for people, but for most people, I think that it should be up to them to say, you know what, I really don't want to spend $100 million to live another 10 years.
Yeah, but you're giving the people to decide in that case. We shouldn't be letting the people to decide. We should be giving them health care no matter what.
Well, like in Canada, if you want good healthcare, you either need to. There's certain things that you can access a private system for.
Mm-hmm.
But if you want really good healthcare, then you're going to go to another country like the States. And so, like the idea that you are providing for everyone by blocking the right to access private healthcare in your country, I don't disagree with. I think it puts a market force that creates a barrier. So I think socialized healthcare system, the people that it hurts the most are the lower middle class and the sort of middle class.
Mm-hmm.
They cannot afford to go to another country to get that care.
Exactly.
If it were allowed in their own country, they probably could afford much better care. Whereas the very wealthy, of course, they can go wherever they want, and the very poor, it's really good that there's socialized healthcare because they wouldn't be able to afford good healthcare.
Exactly. So, well, Scott is saying average doctor IQ score is 120. That means there's probably doctors down in the 105 and 110th, which is worrisome. We should be worrying about the IQ score here. I don't know.
I think they're basically just flesh mechanics myself. So I don't think you need to be super brilliant to do it.
Yeah, and that's what I was thinking. Like, I don't disagree with it, but I don't think like it's like the whole thing. Like, it's not the having a high IQ score doesn't imply that you're going to be a good doctor, right?
Yeah.
Or a good professional.
Yeah. In fact, once you get past a certain point in IQ, you actually start developing a lot of social problems. It's very difficult to interact with other people.
Exactly. So I don't know. It depends. Everything depends. So you may have like a really high IQ score, but you you don't get along, as you said, you don't get along with people. So how are you going to be a good doctor?
Yeah. And you need a good bedside manner to be a doctor because hope is really important. And if somebody trusts you, then they're going to speak more openly about what's going on with them.
Exactly.
And they're going to trust your direction a little bit more.
Exactly. So it as I said, is not what you need, but it's like it's a whole. We cannot look at the IQ score as something that will determine to be a good doctor. But that's how it's been. That's how it's been here. And well, I was just before everyone just starting getting into the live, I was just saying that in my country, they were closing everything. We have already banned all of the public events, all of the state swimming pools and parks. We can still go out. We can still move around the city. They are trying to create conscience in people, trying not to move as much or trying not to gather in parties that have more than 30 people. Police are going around trying to ban all of this or close all of this, let's say, restaurants and bars and discotheques and every single place that will have a bigger amount of people, like more than 30 people. We have already 37 confirmed cases. We have already 2 deaths here in the country. We have already closed the borders. So from starting from tomorrow, no one can travel. I mean, no foreigner can come into the country. And for the locals or residents, starts from Wednesday. So that's what's happening in my side. I don't know what's happening in Canada. Did the Prime Minister said something there, Nicholas?
Yeah, well, they're dealing with it as they can, but I would say that the restrictions are different in different provinces and territories because the infection is happening at different rates. So huge population centers like Toronto and Ottawa, they're taking it much more seriously than in less dense places like the prairie provinces.
Okay.
So I'm hearing in my province, I'm hearing statements about 100 and 250 people, which are obviously much larger than what you're talking about.
Yes, exactly.
I think that part of the reason why our numbers are so low is just because of our testing procedures. I think when they start testing more, they're going to find a lot more of it here. And so I think probably over the next week or two, we're going to see a big change. And I would like to see the suggestion be for smaller groups, like the 30 is a really good number. What's interesting is that this isn't affecting children, it seems like.
No, they're not affecting them. They are supposedly they're having a really good immune system. Supposedly.
And there's not one documented case of a child passing it to an adult that we know of so far. So
Exactly.
that's really interesting, and that's also really helpful because kids tend to really pass around a lot of germs, and so the fact that schools are still open in my area would be really concerning. But
Okay.
I don't think I think it's more of a problem of them taking it back to their parents.
Mm. Look, so Scott is saying they shut down my college in Calgary. In here, they are just like they're getting more vacation here. So um, the kids that were getting into schools and high schools around maybe the next week, they are moving in until April. So at the end of April, they will be starting classes. And for university colleges, um, it will be by internet. So they are doing online courses at the moment. So in here, at least it's been, and it's been controlled. But yeah, I think like in your case, Nicholas, they should be like closing already. I mean, they should be already closing the schools.
Yeah, yeah. Like I don't think my local college is closed yet, and but they did send out a cancellation for or a request for cancellation for public events. So I'm involved with a couple of events with the students there, and that those have been canceled.
Okay. Okay. Well, they should. They should. So Scott's saying we need to enact war measures and shut down the country China style. If we leave essentials only for 2 to 3 weeks, the virus will be gone, like Ryan done by late April. I think so. I mean, that's what's happening here. By the way, that's what they are doing here in Ecuador. At least they are trying to contain the virus in that way.
Yeah, the only thing is the economic cost to what he's talking about. In terms of
Of course.
saving lives, that would be the best option. I don't know about preserving freedom. That would concern me. I don't like the precedent of the government enacting that sort of power. But there is the economic cost, which is something to seriously consider because in the long run, it could actually cost more lives if you have an economic collapse than if you let a few more people get this illness.
Yes, yes, exactly. But it depends on how bad your health system is. And in here, at least, it's really bad. So I'm guessing that's why they prefer closing the borders and not letting anyone to go to big public events or all of these things that I've been mentioning before, than to try to better. I mean, to get better this health system. They were almost collapsing, and it's not more than 40 cases.
Oh, wow.
So we have a really like we have a collapsed health system, and that's how it is. We need to pray in this case. I mean, if you are not religious, but in this case, I think we need to pray because there is anything that we can do at the moment to help the health system to get better. Not even money, because they have to. I mean, they have to take everything out. I know that there's lots of corruption there, and people are still getting money out of people's pockets, even if it's the state health system. But it's because they are selling the medicine that should be given for free. So that's one of the things that it's happening at the moment. So, and you're only receiving paracetamol, so it's just that pill, and that's it. And then you can go home, and that's how it is.
Yeah, I consider myself to be extremely religious, and I think that a faith in God is really important. Studies have shown that depression lowers your immune system. So that hope that I was talking about earlier can actually
Mm-hmm.
help you fight this. And when you are praying about things, even if God didn't exist, you would be thinking conscientiously about that topic and you'd be trying to order it within yourself. So you'd be coming to a little bit of peace with it, but I think you'd also be drawing it to attention and making plans about it. So yeah, I think an atheist should recognize that it's good to have theists around to praying and thinking about these things, and they should see if
At least to be
be gained out of it.
exactly, at least to be saying, I hope because that's the word. I hope that everything goes better, right? Or everything
Hmm.
gets better. But that I hope, to whom you are hoping to, like
Yeah, you have to have
you're
faith in something. Yeah,
yeah,
yeah.
exactly. So Scott's saying, I'm all for civil liberty. I've got a paw, but if we can end this virus ASAP, let's shut it down. I think we should. I mean, it depends on where you're living, right? But I think we should. Every single place should be shut down momentarily. Like it will be like for 1 week, at least 2 weeks. Because even if we're talking right now and we are confined to our houses or our apartments and we're staying here for a while, there will be people that won't listen. And those people are the ones that have to be contained. For instance, I saw a picture today and a video, I think, of some of the beaches that we have here in the country, and it's still packed. People are still going there. I'm not saying you shouldn't go, but I'm hoping that they're taking the measurements, like to not getting too close to the people around, or just trying to have alcohol with them, like to like rubbing alcohol with them, and I don't know, being careful not to getting closer to people that are sneezing or coughing or think they have the symptoms. Like it's easier to get the disease if you're traveling around the country than if you're staying at home and then you decided to get some groceries in a controlled manner.
Yeah, I would like to see things that would be options for people that the government could provide, like, for instance, delivering groceries. If you had a grocery delivery system that was sort of planned and paid for or organized or something, and the government encouraged people to do that rather than to go to the grocery store, and to do that sort of thing with public things where you're not forcing people to not come into these public places, but you're giving them this option where they can be a little bit more responsible. And I think if
Yes,
not everybody
exactly.
does it, even if some people are going to the grocery store themselves or whatever, then there's going to be a lot less, and the danger will be a lot less.
Exactly. I mean, we do have a private one here. We don't have like the like an estate one, because it haven't been any. I mean, haven't been necessary to do that. I don't think they will be doing it now. But we do have a private, like a private delivery
Right.
for groceries,
Yeah,
but it
it's the
costs,
same.
right?
Yeah, it's the same here in Canada. That's right. But that cost is prohibitive, and so that's why if the government were to offer to pay for it in a crisis situation like this, people would take them up on it. Whereas a lot fewer people would take them up on it if they had to pay for it themselves. You know, if the government
Yes,
just said, "Hey, consider getting your groceries delivered," some people will pay attention to that, but not as many people as if the government said, "Hey, we'll pay to get your groceries delivered. Please do this."
of course, that's true. Okay, so Scott saying, I didn't know depression lowers your immune system. Oh,
Yeah,
it
that's right.
does.
Yeah,
It does. It
stress,
does. So
depression.
if you're depressed, your immune system will just shut down. Will shut down immediately. And we do have a close example. The second person that died from the coronavirus was the sister of the first lady that died here. And this
Oh,
second lady was okay. She had They said that she was okay. She was confined at home. She was in quarantine. So the thing is that as soon as she knew that her sister passed away from the disease, she got like in shock. Like she just her health just went down, and she got a heart attack and
oh,
died.
wow. Okay.
Mm-mm. So that could happen. So I have an example, like clear example of, if you get yourself into that position, even though I'm guessing that because she was older and she knew what her sister was going through and her relatives, thinking that your sister died and you are the one that is next, just pushed her to death.
Yeah. Yeah. It's
Yeah,
amazing how powerful the human mind is. In just regular circumstances, stress gives you things like ulcers, and that could kill you. Uh,
exactly. And it
and
depends on you. I mean, you are going to let yourself die.
yeah, yeah, and it goes both ways too. Like you can hear these things and be really frightened by it, or you can think about it and say, "Hey, if I develop some mortal fortitude or mental fortitude,
Mm-hmm.
then I'm going to be a lot stronger against these sort of things. This is something
Yes,
that I can develop."
exactly. But it depends on you. I mean, it depends on your state of mind, mostly.
Yeah.
So Scott's saying we could totally get the Canadian forces rolling out the LAVs loaded up with groceries and delivering them. They haven't been at war since 2015. Let's get them doing something.
I think they would be happy to do it. I know some people in the forces, and I think they'd be very pleased to be offering this public service. I think if they offered it up to volunteers as well, there's a lot of
Mm-hmm.
people with a few extra hours in their week that would be happy to do it.
Well, I'm guessing, but it depends on the government as well because they will have to be providing the groceries, or if the people are willing to buy their own groceries and they will be delivering to them. I mean, I don't know exactly how the system will work in that case.
Well, I was thinking that people would still be ordering their own groceries, just like the private delivery system now, but
Mm-hmm.
it would just be a free service to deliver it. But still, even if you had volunteers doing it, you still have to pay for things like gas.
Oh,
So
yeah, that's logical. That's logical. Oh, wow. It's been it's been really crazy. The last couple of days has been crazy. Like things up. I mean, everything has been unfolding really quickly. So I don't know if they're going to say that we need to be in quarantine soon. Hopefully not. Scott's saying, yeah, you should still pay. It's just you don't gotta go out. It is. It's better to stay at home. I mean, I already have my groceries. Hopefully, it will be lasting until next week. So
I
let's hope it doesn't happen.
I went to the grocery store on Thursday, and it was
Mm-hmm.
literally the busiest that I've ever seen it. It's a very large grocery store, and it was totally packed. And I was looking around. I was just getting regular groceries, but I was looking around at other
Mm-hmm.
people's packed like
Mm-hmm.
carts, and they're obviously preparing. And
Okay.
I was thinking, all these people are worried about the coronavirus, and they are going to basically the worst situation for that right now.
My God, in here it's been like crazy as well. We have seen pictures of people are just like taking their whole trolley with meat. Why are
Yeah,
you taking the whole trolley with meat? I mean that's been the busiest time to get meat because everyone is just taking it out and taking it all from the shelves. So Scott's saying this old Chinese guy coughed on me at the grocery store this morning. Hope it was just a cold.
well, yeah. I hope you didn't get it on your face, and you washed your hands when you got home. But I don't think you should worry too much. I don't think that it's too much more concentrated among the Chinese population than the general population.
Yes, I mean I think it came from China, but we don't have to overreact to people that are Chinese and that are coughing or sneezing.
Yeah, most people that are here in China, in whatever country you're living in,
Hmm.
didn't just come from China and didn't just talk to somebody that just came from China.
Exactly. So we just have to make sure that we don't go around and be paranoid about it. We we need to take care of ourselves, but also our mental health.
Yeah,
Else, we're just going to be worrying about every Chinese or every people that has like you know their eyes all like this, and we'll be like, oh my God, he's a Chinese, but is actually, for instance, we have a colleague that looks like a Chinese guy, but he's a Venezuelan guy. So
okay, yeah, yeah,
so you are convinced that this guy might be talking in Chinese and might have the coronavirus, but he's the complete opposite.
right, yeah.
So
Is
We need
he?
to
Does
mix
he
it
have
up.
any Japanese ancestry or something? Because I know that the Japanese
I'm
went to Brazil
guessing.
and stuff. Okay.
I'm guessing. I mean, I haven't even asked him, but I've always like worked next to him, and every time people are just talking to him in English because they believe that they're going to talk to someone that knows. I mean, they know. I mean, he's a Chinese, right? So, or they speak to him in Chinese, but he's not Chinese. He's just Latin America. So that's why we don't have to we shouldn't be overreacting to it, even though it's a Chinese guy or a Latin American guy, or I don't know, someone that comes from Europe. It
Yeah.
doesn't matter.
Did you see the remake of The Karate Kid? The Karate Kid, the
Ah,
remake one with Will Smith's son.
no, I haven't, but
Oh,
I've seen pieces of the movie,
there's
just
this
pieces of it.
there's this one scene where the mother and the son are flying to Hong Kong. They're in the movie. They go to Hong Kong to live, and he's really
Okay.
upset. But his mother's trying to prepare him for life in Hong Kong. He's like trying to teach him a little bit of Chinese and things like that. And so they're on the plane, and she's like, "Okay, go try it." And she points to this Chinese guy that's sitting next to him, like
Okay.
just across the aisle. And he's like, "No, mom, I don't want to do it." And he's like, "Go on, you got to practice." And so he leans over and he says, "Ni hao, ma." And the
Mm.
guy looks at him and he goes, "Ni hao, ma." And the Chinese guy says, in perfect English, "Dude, I'm from Detroit."
You see? You see, like it's like paranoid. It's just being paranoid, just trying to think that that person is also going to speak the language, but it doesn't.
Yeah.
Uh, okay, so Scott is saying people are buying the wrong stuff, I swear. Sure, canned and powdered food lasts the longest, but it has low nutritional value. Better off buying healthy produce so you will be ready to fight the virus, which is true. But some people cannot afford it, or some people cannot reach out to it on time. And I think that's a problem. For instance, if I didn't if I mean I went to get my groceries like a week ago. If I couldn't at this time, it will be packed because it's the weekend. And apart from that, people are just like crazy over the coronavirus. But the thing is that you should be taking care of what you eat every time. If you eat healthy, then it's fine. Just get your groceries, just get it for a little more time, and that's it. Maybe you can get some canned food, but it will be lasting you for a little bit longer if you don't get your healthy food, right? If you get tuna or you get certain things that are canned, it's fine. You can eat that like for a day, but it's not that you're going to be eating them for like 2 weeks. That would be crazy.
Yeah, but this might be sort of happening in stages in terms of people prepping. You know, they
Mm-mm.
might be saying, I can freeze meat, I can keep these canned and powdered foods, even if there is not a serious crisis or a food shortage. These things will last long enough that I can use them in my normal life. And
Exactly.
if there is more of a crisis coming, then after they've bought these things that cannot be wasted, maybe they'll get things that are more perishable, like produce, because they are preparing for that stage. You know, this might be the thing.
Exactly.
Like a low risk venture might be getting these non-perishable things.
Exactly. I mean, if you ask me, yes, I'm missing buying the canned foods, but I will be buying them just to eat them like not regularly, just for a couple of days.
Sure.
If there is some like need to do it. I mean, we do have lots of things that can be bought fresh instead of being canned, right? That's our benefit here. We like that. We can buy tuna that's fresh. We can buy,
Oh, that's great.
yes, we can buy almost everything can be fresh, fruits and vegetables as well. But for instance, in here, We have a really marked difference in between the people that delivers um, the fruits and vegetables, because it comes mainly from the highlands, and there are people from the highlands that wants to get into a riot because of what the president has been saying the last couple of days about, the economic views of what they're going to do to fight the coronavirus, right? So they does not agree, and they want to go into a riot. And the last time that they did it, which was on March, no, I'm sorry, it was on November, I think, of September last year, it was terrible because we didn't have any fruits and vegetables to buy, not even meat.
Wow.
So that will be something hard on us. So in that case, only in that case, I will have to buy canned food. Only in that case. And even that, I think that will be gone, because that's how people are. That's what happened the last time.
Sure. Yeah.
Mm-mm.
And if you can afford them, like I personally don't believe vitamins and vitamin supplements are absorbed as well by the body as natural sources, but they are really important. So I would say if you can afford to get a few vitamins, then do
Oh
that.
yeah.
It'll definitely help you. Yeah.
Oh yeah, of course, of course. I mean, there are certain things that you can do to actually help those vitamins to be absorbed better into your body. So, if you need to buy like the multivitamin, then you need to like check which kind of food you need to eat or drink in this case, just to be able to have this multivitamin to work in your body.
Oh yeah, definitely for things to help absorption. Yeah,
Mm-hmm. Yeah,
like
yeah,
vitamin D
that's
and calcium.
exactly. Exactly. But for instance, don't be drinking coffee and then trying to have calcium,
Oh
right?
really? I didn't know that.
Yeah, because caffeine doesn't let the calcium to be absorbed correctly into your system.
Oh.
Yes, and if you want to have like, what's this called? Well, it's ferrum. Ferrum, I think it is. Uh, Iron. I'm sorry,
Okay.
iron. So you need to consume vitamin C. So it will be better for you to drink a lemonade or something that has like vitamin C before you have iron.
Oh,
It
okay.
will be
Interesting.
it will be the best absorbed at that moment.
Yeah, you see, those are the things that people really need to know. I don't know a lot about that, but that's really useful information.
Exactly. I mean, those little things that you need. I mean, what to avoid and what to have before you get your multivitamins, or before you even like eat something. Like if you're going to eat spinach as well, if you're going to eat meat because you need iron, sure, just have like a lemonade with it.
Right, right.
Mm-hmm.
I it makes sense that you confused iron and ferron because ferrous in Latin means iron.
No,
So,
it's because the name of the medicine that I'm taking is ferrum.
oh, okay, okay,
That's how it's called. So the first word that came into my mind was ferrum, but it's iron actually.
okay, yeah, yeah.
So that's why. So that's why I say ferrum at at first. Yes. So okay. So I think the life has been going a really long time now. So I was just going to pop up later. I don't know if you're going to be able to be later on in the live.
I won't make any promises, but I'll keep my eyes open. I don't have a lot to do today, so I might be around.
Yeah, I'm just going to try and pop around maybe 9:30. I mean, I have tried the last couple of days, but it's been quite crazy. But I think today will be the day. So I'm just going to read the last couple of messages that says here is, you hear about people buying up guns and ammo in the States. People need to write it out in isolation, not riot in crowds and overthrow the government. Yes, it's true. But I don't know why people are just buying guns. Maybe they're just trying to protect themselves. Maybe they think there is a zombie outbreak instead of a virus outbreak. So for it saying, I put together a tea, garlic, and raw lemon. I think you're missing also the ginger there. Tea and ginger, it's really good for your immune system. You have a tea with ginger every day, you will have a good immune system. And if you have this other ginseng, ginseng, I think it's called.
Ginseng. Ginseng.
Yes, it's a really good way to get your immune system up. Maybe they think 22s are small enough to shoot the virus.
I think they're probably worried about government tyranny, but also about social unrest. And
Mm-mm.
guns are a good way to stand up against both of those.
Yeah, but that will be like too much. I mean, I think it'll be like too harsh if you want to like protect yourself. What if someone is going to go closer to your door trying to, I don't know, throw it down? That's
Well,
the way you're going to use it.
owning a gun doesn't mean you have to use it. So you can decide wherever your line is. If you've got people out in front, then maybe you don't want to use it. And if you've got people breaking down your door, maybe you don't want to use it. But maybe if you've got somebody with a knife to your sister's throat, you do want to use it.
Of course, that's a different thing. But I don't think that you will be able to react as soon as you want in that case.
Might just be a security blanket too.
Yes. So Sephora is saying, I bought extra immune vitamins, eating greens, and lots of sleep. I think that that will be the best medicine in this case. And they have been watching too many movies of the end of the world. I'm guessing so. And I'm thinking,
Contagion is being rented so many times.
I'm thinking that they are just like trying to convince themselves this is like a zombie outbreak instead of like a normal pandemic disease that has to be taken care of in a different way. I mean, using guns is not the best solution, as always. So Scott's saying, I'm worrying about tyranny after the pandemic. Government is most dangerous when they have nothing to do and create problems that don't exist. I don't know. I don't think that they should be changing at any time soon. They should be like trying to control the virus and then going back to normal. But yes, people should be aware of this kind of things. Sephora said, I have ginger. I will put it in my new batch. Maiming it right now.
Making right now is probably
Okay. Yes, I'm guessing. Yes, ginger is, I think, is one of the best things that you can put. Like I usually have a chamomile tea with ginger and lemon, not garlic. I think it will be like too strong. But ginger and lemon, that's the perfect combination. And some honey as well. Honey is really good as well for your throat, at least.
Yeah, that sounds great. And sit back and watch a comedy, something that'll make you laugh, because that raises your immune system as well.
Exactly. And go out and receive the sun for a little bit as well, if you can. I mean, that will be the best choice to do. Because they are saying that this virus is it doesn't survive in high temperatures, supposedly. So I'm guessing that the people that are feeling unwell, they're covering themselves, they're with the air conditioner, with like not closer to the sun. So go out, enjoy. I mean, not going out to a gathered place, but at least going out to your front door, receive the sun, and I'll think that'll be the best. Okay, so for saying sorry, Lowell, making it right now. Yes, I think that will be the best for us just to make tea. Okay, guys, so I'm just going to leave for a while. I think, as I said, I think I will be around maybe 9:30 to 10, so we can chat.
Because people are in different time zones. You should tell them how many hours that is.
Yes, right now is 3:32 p.m. So I'm guessing it will be like in 6 hours around that time. So if you want to pop up, if you want to come here to just chat a little bit, I'll still be here, I think, hopefully. It'll be 6 and a half hours. If you have turned on your notifications, then you will definitely get it. I thought it wasn't working, but Sephora told me that it is, so I'm fine with that. So, okay, I'll leave you for a while, guys. Thank you, Nicholas, for being around as always, for being here in the StreamYard.
My pleasure. I'm your favorite co-host, aren't I?
Of course, no one had ever tried to pop up just like you, like talking next to me, which is great. I love it.
I'm so glad to be here.
So, okay, guys, thank you for being around. I'll be talking to you guys later on. Bye bye.